now I'm trying to think of making up another one, but I got to make it up so that it's not so good. So I'm working on it. I used to have one. So for this kid with the diaper rash, is that significant enough to require additional and add another office visit and have 2 office visits for this one, because you have a separate code for your 99 whatever 380 something, whatever it is, wellness exams? No, not diaper rash, but what if the doctor hears a new heart murmur, that they didn't hear before? That's something we would have to work up. We would have to get like a family history on. Okay, Mom, anybody else in the family have a heart murmur? We'd have to do a full exam, check the pulses on the baby, make sure the arms and legs are all getting good blood flow. And we probably do a referral to a cardiologist. So that would constitute a regular office visit and the wellness exam. So knowing that guideline will help you out for your online exam for sure. What do you mean not so good? I know. It just had way too much information in it that was just too good. It was just too good. It was. I did have something, but I'm working on it. Let's see. Okay, right here. What are MIPS stand for? In the beginning of your ICD-10 book, you've got these color codes that are in the front of your ICD-10 book, and some of your ICD-10 codes aren't black font. They're pink or red or green. You got all kinds of colors. They all have significance depending on what color they are. And MIPS, I think, are pink. So every time you see a pink diagnosis code, that means it's significant. And it should be significant to the physician and to the coder. Why is it? Knowing that kind of information will help out. And you find all that information out in the very front of your ICD-10 book. I took the exam on Saturday. One question was how to code a twin C-section with antepartum. And so did the mom ever have a C-section prior? Was this her first C-section? So remember, all of our baby codes, the second and the third digit are divided by 94, 95. Codes here. They all start with 5. Yeah, 5. So this is just the first 3 digits of the CPT code. If it's a 94, we know that's a natural delivery of baby, right? If it's a 95, this is the C-section baby. If it's a 956, that's a combo. That means we've had a previous C-section. We're going to try to go natural today, but we may end up with another C-section. So knowing a little bit about mom's history is going to help us. If it's the first time the mom's ever had a C-section, then we're going to be in the 595 range. Always. For that. That was a TikTok question. Be sure to know your symbols in the front of your CPT book. And they're usually the symbols that are on the bottom of the left-hand side of any page of the CPT book. The other one they do is the Harry Potter lightning bolts thing. I couldn't figure out how to do that in a printable thing, but the lightning bolts, sometimes they ask, what's that symbol mean? But they're right on the bottom of every CPT page on that left side. Super helpful to do that. Thank you for the 700 likes on the TikTok live and the shares on that. I appreciate it. on guidelines. This is the top 10 guidelines list that I do have that I think that are important to know for the exam. Burns, external causes, chemo, immunotherapy, radiation, anemia associated with malignancy, anemia due to treatment or chemotherapy treatment, immuno versus radiology. So if you have anemia due to chemotherapy and immunotherapy, it's one particular code. If it's due to radiation, it's another code. So be sure to know those differences. Kind of crazy there. Dehydration due to malignancy, it's coded in a different situation. Dehydration due to treatment, like due to chemotherapy, it's coded a different way. Those are also helpful to know. Underdosing, overdosing, two different ways of doing those. Stages of your ulcers, your high-risk OBs, the rule of 9, which is your burns, part of your burns guidelines, and adverse and poisoning, which we just did. Poisoning yourself means the T code goes first. If the doctor does it to you, the symptoms go first, that kind of stuff. A cause and effect relationship between hypertension and which of the following has a complication. Is it just heart disease or just kidney disease or both or retinopathy? This cause and effect might show up on your exam. I take those guidelines and move them to the codes where it's needed so that I know it. And used to be, back in the day, there was the STEMI and InSTEMI questions. And if the question ever starts out with InSTEMI or STEMI, the answer is always going to be STEMI. If the question starts out with AMI, the answer is going to be AMI. There's usually ICD-10 questions. One will be about pregnancy, one will be about a burn patient, one will be about HIV, one will be a heart attack. Like, I think I had one with impending heart attack. Impending MI. How do you code that? Just look up impending in the front of your ICD-10 book, and it gets you to ischemia. So it's ischemia. Same thing as that. Here we go. Get you the answer to that one. Of course, it is for both heart disease and chronic disease when you try to answer this question for the hypertension right there. Super cool. Don't forget, you need to know where your place of services are. The very first page in your CPT book. It's way in the front of your book. You need to know if they ask you to code a service code, and that may be all they say. They may not even say the word place. Just saying service code might be all you get, and you got to figure it out. Like this question over here to the side. According to CMS, what is the proper POS code for a transpharyngeal Doppler cardiac monitoring? Where would you do that at? And you just have to search these place of service descriptors until you find something on that page that is, or a place that will do Doppler cardiac monitoring. Math, if there is math, you may be getting baby grams, like a baby weighs 1,500 grams. And then in the front of your E&M section, you have some E&M codes for premature babies that are done by ounces. And you have to figure out how many grams are in an ounce. and figure out how premature your baby is based off that. So I include a little conversion for grams and ounces, and I put it beside each one of the CPT codes for those premature babies in those E&M codes in the front of the book. So grams to ounces, and then the other one is if you're in HipPix and you're doing any one of those codes where you might be doing a J injection in HipPix, so like J, I don't know what the code would be, but J100 for dexamethasone, so a steroid. It comes in 5 milligrams per cc, but your doctor ordered 10 milligrams. How many units do you bill? Not too bad right there. Equals 2, right? You won't have that much of an issue with that. So it's not too bad. Just the grams to ounces if you do get the premature baby question, but I haven't seen that question, or nobody's told me about that question, being on it for a few years. But there are a couple of those newborns. You had an RVU question. Are there any? No, not on the CPC exam. For a HEMA, CCS, maybe one, but not for CPC, no. Compliance and regulatory, things you might need to know is the definition of an ABN. What's the definition of a UB04? I don't know why I call it UB40. Seems like it should be that. Who's MAC? Medicare Administrative Contractor. What are they in charge of? LCDs, who are they? What are they in charge of? Definition of a CMS 1500. OI, not often on there, but I have it on my list. And then HIPAA. They love to ask about HIPAA. Yep. Like who's in charge of it? Is it OIG or is it MAC? Those kind of things they might ask. They might also ask for compliance and regulatory. You only have 3 questions. So for HIPAA, which entitled is not covered under HIPAA? Is it psych, chiro, the insurance company, or workman's comp? You know it's workman's comp. If workman's comp is paying for the visit, they get all your medical records for that particular thing. What part of Medicare covers a SNF? That's a skilled nursing facility. If you don't know your acronyms, you should know those kind of things. In the front of your CPT book, there is this anatomy chart that divides things into different planes. I use this for my radiology section too. Don't forget about that being up there in the front of your CPT book when you're answering your radiology questions. But know things like AKA terms for these terms, like your posterior aspect means your back trunk, right? Your anterior aspect means your chest, right? Dorsal surface means the top of your hand. Palmar surface means the bottom of your hand. Top of your foot, those kind of things. Trichomonas, be sure you know the definition of that. How many layers of tissue does an artery have? 3. Chambers of the heart, what are they? How many are there? What connects the patella to the femur? What connects bone to bone? What connects all that kind of stuff they may ask. Kind of crazy. What does HIPAA stand for? What is a mid-level provider? Who is not a mid-level provider? Anesthesiologist is not a mid-level provider, but a PA is. Be sure you know where to find these dates in your CPT book. The date that the codes are released is a different date than the date that they go into effect. They may ask you the effect date or they may ask you the release date. 2 different dates, so pay attention to which one you pick out and choose. Super important. Which organization provides guidance on compliance? That's OIG. And then your Draco Malfoy diagnosis here. Dre, I call it that because I think of him crying all the time. So this is your tear ducts, your lacrimal sacs in your eye that are produce tears. If you have an infection there, this is that diagnosis right there. So that's kind of handy dandy to know. You don't get a degree if you finish a program. AAPC will give you a certificate of completion, but they don't give you any degrees. You have to go to a college to get your degrees for whatever you want. Exam point of view, to get your medical certification, which you need to get a job. You don't need a degree in medical coding or in anything at all to get a job in medical coding. You just need to have that certification, I mean. It's just one certification exam you need to take. E&M changed a whole bunch this year. I have a little chart. It's free. It's on my website if you want it. And it is changing up of all of our E&M codes. If the code was a certain code in 2022, this is what the code is now in 2023. So that's what I did for all these codes, and then they changed. And if you do, you need to update your times, because like 222 changed from 50 minutes to 55 minutes. The 23 changed from 70 minutes to 75 minutes. Those kinds of things, just updating the times on all that. The observations codes for the admit and discharge in the same day also had time changes too. So, oh, the connection is freezing. Be sure and connect with, watch this replay or watch it on YouTube, where we should have a